Assalamualaikum. So today we are presenting to you about hazard identification and health exposure to workers at hospital. Our group consists of 4 members, which are MAIZATUL, AKALIL, DHIYAUDDIN and FIRDAUS.
Now we go to the background of the study. Hospitals are risky workplaces with a high number of work-related illness and injuries. In 2019, US hospitals reported 221,400 cases, equivalent to 5.5 incidents per 100 full-time employees, almost double the rate of the entire private sector. This danger is global, spanning from major cities to remote locations, posing various challenges to healthcare workers based on their assignments. Workers must overcome these challenges to ensure patients' physical well-being. Now we go on to the objective. The main objective of this study is to identify biological, physical, chemical and psychosocial hazards in hospital. The first one is to identify the challenges that are faced by hospital employees relating to their safety and health. Second is to determine the effect of hazard to worker in hospital industry. And lastly is to identify whether the existing safety measures is adequate for hospital employees and corrective action to eliminate or reduce hazard.
So next, we talk about literature review. Overview of hospital. The healthcare sectors include many industries, sub-industries and a wide variety of companies. Any company involved in product and services related to health and medical care is represented in the healthcare sector. Hospital, an institution that is built, staffed and equipped for the diagnosis of disease or for the treatment, both medical and surgical, of the sick and injured, and for their housing during this process. The modern hospital also often serves as a center for investigation and for teaching. Next, hazard at hospital. At hospital, we have biological hazard, physical hazard, chemical hazard, psychosocial hazard, and environmental hazard. First, we talk about biological hazard, which is bacteria. Bloodborne pathogens are microorganisms that transmit disease by contact with blood. Contact may be direct, such as needle stick or splashes of blood containing fluid to the mucous membrane or open wound, or indirect, such as when surfaces contaminated with blood come in contact with someone's mucous membrane or a barred skin. For the health effect, it can cause persistent infections, chronic liver disease, and hepatocellular carcinoma in the long term. In acute illness, it causes fever, anorexia, and jaundice, and rarely acute liver failure. HIV infection may cause an initial infection with flu-like symptoms. Without treatment, HIV progresses to AIDS, which damages the immune system. Next, viruses. Medical waste generally include cultures and stocks of infectious agents like discarded vaccine and culture dishes, liquid human and animal waste, materials stained with blood or body fluid, pathological waste such as tissue or organ, used sharps, and waste from animals that have been exposed to agent infectious to human. For the health effect, exposure to radioactive waste in the waste stream can also cause serious health hazard. HIV and hepatitis viruses spearhead an extensive list of infections and diseases documented to have spread through biomedical waste. Physical hazard. Lifting heavy object. Lifting heavy item is one of the leading causes of injury in the workplace. Strain and sprain from lifting loads improperly or from carrying loads that are either too large or too heavy are a common hazard associated with manually moving materials. For the health effect, back injuries are caused in part by job design, improper body mechanics, equipment and patient handling, and transfer. You can strain the muscle in your back and injure yourself if you do not use the proper body mechanics. Next, radiation ionizing. Radiation is a form of energy. Unlike some other type of energy such as heat, infrared radiation, or visible light, the human body cannot sense exposure to ionizing radiation. Nonetheless, absorption of ionizing radiation energy by body tissues causes changes to the chemical makeup of living cells. Health effect. The effect of exposure to ionizing radiation appears sooner or later after a latency period. Our body are designed to deal with the low level we are exposed to every day. But too much radiation can damage tissue by changing cell structure and damaging DNA. This can cause serious health problems, including cancer. Sleep, trip and fall. Work-related sleep, trip and fall incidents can frequently result in serious disabling injuries that impact a healthcare employee's ability to do his or her job. For the health effect, sleep, trip and fall as a whole are the second most common cause of lost workday injuries in hospital. Sleep, trip and falls are the most common causes of major injuries at work. They occur in almost every workplace, with 95% of major sleep resulting in fractured bones. The consequences vary greatly and injuries are mainly caused to the bone, joints and muscle. Ergonomic. Ergonomic is an applied science concerned with the design of workplace tools and tasks to match the physiologies, anatomic and psychological characteristics and capabilities of the worker. More simply put, ergonomic involves adapting the work environment to be within the worker's capabilities and to prevent injury, illness and stress. For the health effect, poor workplace design, repetitive movement, awkward body mechanics or posture, and other hazards produce or contribute to a staggering number of disabling cumulative trauma, illness, and injuries. Next, chemical hazard. Sensitizer. Sensitizers are also known as allergens, meaning they can cause an allergic reaction in people who face repeated exposure over time to certain chemicals. Reaction to chemicals deemed as sensitizer vary from person to person and can be either acute or chronic. Health effect. Exposure to low level of chlorine can result in nose, throat, and eye irritation. At higher level, breathing chlorine gas may result in changes in breathing rate and coughing and damage to the lungs. Carcinogen. A carcinogen is a substance, organism, or agent capable of causing cancer. Carcinogen may occur naturally in the environment, such as ultraviolet ray in sunlight and certain viruses, or may be generated by humans, such as automobile exhaust fume and cigarette smoke. Health effect. In hospital, skin exposure to formaldehyde can cause sensitization, which can lead to dermatitis upon contact with small amount of formaldehyde or formalin. Other health effects of formaldehyde exposure are irritation and burning of nose and throat, irritation of mucous membrane, burning of the skin, coughing, and vomiting. Formaldehyde is also highly flammable. Psychosocial hazard. Psychosocial hazard and risks are important for work psychology. Psychosocial hazard is the potential to create psychological, social, or physical damage due to the nature of the work and the physical factors in the workplace environment. Psychosocial hazard created by the balance between abilities, physical and mental business demand, technological changes, workload, pressure by the management, inadequate social support, unsafe working atmosphere, and role conflict cause stress and lead to various risks. Health effect. Psychosocial hazard caused by the work may lead to stress, and it is known that they cause serious risk for the employee's health and safety. Healthcare workers experience high rate of mental ill health such as burnout, stress, post-traumatic stress disorder, anxiety and depression due to psychosocial workplace conditions, including excessive workload. And lastly, environmental hazard. Healthcare facilities generate many types of liquid, solid and gaseous waste in large quantities. Medical waste is considered to be a part of hazardous waste because of its negative impact on workers in health institutions, society and public health if not properly managed. The meaning of medical waste and what it can include should be clarified at first. WHO defines medical waste as waste from healthcare operation. For the health effect, medical waste may become an important cause of illness or death if not managed properly. The most important risk of infectious medical waste is the transmission of many diseases such as hepatitis B or C, as well as HIV by wounds caused by human blood contaminated needles, as well as by many hazardous chemicals that may be harmful, flammable, interfering, or other hazardous effects.
Now, let's move on to discussion. In this part, we're gonna talk about HIRAC, control measures for biological hazard, physical hazard, chemical hazard, and psychosocial hazards. First, let me explain what is HIRAC. HIRAC stands for Hazard Identification, Risk Assessment, and Risk Control. It is a systematic approach used in various industries to manage occupational health and safety risk. The process involves identifying potential hazards, assessing the associated risks, and implementing control measures to minimize or eliminate those risks. HIRAC is essential for ensuring workplace safety. By systematically identifying hazards, assessing risk, and implementing control measures, organizations can prevent accidents. This is because HIRAC helps in recognizing potential dangers, allowing proactive measures to prevent accidents and injuries. Second, compliance. The reason is it assists in meeting regulatory requirements related to occupational health and safety. Third, protect employees. This is attributed by understanding and managing risk. Organizations can create a safer working environment, protecting the well-being of employees. Fourth, improve efficiency. The explanation lies in identifying and addressing risk leads to more efficient processes as potential disruptions are minimized. And fifth, cost reduction. This is derived from proactive risk management can reduce the financial impact of accidents, injuries, and property damage. And last but not least is enhancing reputation. The cost for this is prioritizing safety through HIRAC contributes to a positive organizational image and demonstrates commitment to employee well-being. In summary, HIRAC is a crucial tool for organizations to systematically address potential risks, fostering a safer and more productive work environment. The risk level, you can observe it here. 1 to 4 is low risk. It is considered acceptable and further action might not be necessary. However, if the risk can be resolved quickly and efficiently, control measures should be implemented and recorded. 5 to 12 is medium risk. It requires a planned approach to control the hazard and applies temporary measure if required. And lastly, 13 to 25 is high risk. It requires immediate action to control the hazard as detailed in the hierarchy of control. Here you can see the HIRAC form I did specifically for employees in hospitals. The first one is manual handling. The hazard is lifting heavy objects which then can cause back injury. The existing control measure is having a regular breaks between objects lifting. The likelihood times severity make the risk level 15, which are high risk. The recommended control measures are proper body mechanics, posture, lifting techniques, and improving the workstation to an ergonomic design. Next, handling chemical. The hazard is carcinogenic chemical which then can cause cancer development. The existing control measure are wearing PPE, which are respiratory protection, and gloves. The likelihood times severity makes the risk level 16, which are high risk. The recommended control measures are provide disposable protective clothing, provide training and education. Third, handling patients with infectious disease. The hazard is bacteria and bloodborne pathogens which then can cause infections and disease transmission. The existing control measure is employee vaccination. The likelihood times severity make the risk level 12, which are medium risk. The recommended control measures are provide PPE such as gloves, mask, eye protection and gowns. Other than that, safe work practices such as recapping needles need to be done. Fourth, medical waste disposal. The hazard is virus and infectious agents which then can cause infection transmission and sharp injuries. The existing control measure is waste segregation, color coding for different types of medical waste. The likelihood times severity make the risk level 12, which are medium risk. The recommended control measures are provide secure containers, leak-proof and puncture resistant. Other than that, properly label the medical waste. Fifth, Handling patients. The hazard is slips, trips, and fall, which then can cause fracture bones. The existing control measure is proper lighting. The likelihood times severity makes the risk level 12, which are medium risk. The recommended control measures are adding handrails and guardrails. Other than that, secure handrails attached in stairwell. Sixth, high workload. The hazard is work-related stress, which then can cause burnout, anxiety, and depression. The existing control measure are communication and support. The likelihood times severity makes the risk level 10, which are medium risk. The recommended control measures are allowing more frequent breaks in work schedules. Other than that, provide a health and wellness program. Seventh, handling chemical. The hazard is sensitizer, which then can cause allergic skin reaction and nasal passages inflammation. The existing control measure are wearing PPE such as lab coat, gloves, goggles, mask, and respiratory protection. The likelihood times severity makes the risk level 8, which are medium risk. The recommended control measures are provide adequate ventilation system. Other than that, hygiene practices such as regular hand washing. Next, we're jumping on the control measures for each one of the hazard. First one is biological hazards. For engineering control, improvement of ventilation, partial isolation and separate ventilation, and air conditioning system. Administrative. Use biohazard bags to dispose contaminated materials, provide adequate training to the employees, personal hygiene practices. Employees also need to follow standard operating procedures. Lastly, housekeeping. Clean and disinfect all equipment and work surfaces. For the last control measure is PPE. Wear masks, gloves, protective clothing, eye shields, face shields, and shoe covers. 4.3 Physical Hazards Control Measure. Substitution. Patient transfer sheets. These are friction-reducing patient transfer and repositioning sheets. It prevents back injuries and reducing physical strain. Engineering. Use absorbent pads placed on the floor around the operating room table. It reduces the risk of slips, trips, and fall. Use radioisotopes and radiation-producing machines. Administrative. Assign more staff to lift heavy objects. Encourage proper body mechanics and use of safe lifting techniques. Label all loads with their weight and store heavy objects at waist height. And lastly, PPE. Wear gloves, knee and elbow pads and footwear. 4.4 Chemical Hazards Control Measure. Substitution. Replace products known to be carcinogenic with other products. Engineering controls. Use a properly functioning laboratory fume hood. And lastly, PPE. Wear proper clothing such as long pants that covers legs and ankles. Wear closed-toed, non-perforated shoes. Wear goggles and face shield. 4.5 Psychosocial Hazards Control Measure. Addressing staff numbers to reduce high quantitative demands. Hiring more staff to replace personnel on extended leave. Reorganize work schedules and adjusting working hours. Add more frequent or longer breaks. And lastly, provide counseling program.
The research methodology in this chapter serves as a guide to the author in achieving the objective and scope of the study. Using the database PubMed, Google Scholar and Science Direct, we search the literature for any journal published in the English language. The following keywords were included to the search in order to find pertinent articles: healthcare industry, hazard in healthcare industry, and occupational hazard among healthcare workers. The literature search results were categorized into 4 main groups based on the research outcome: chemical, biological, physical, and psychosocial dangers. The outcome of assessment are used to inform decision on control measure and tolerability. Data used in the study authoring was gathered, processed, and analyzed from reputable publications in order to meet the goals and parameters of the review. In conclusion, hospitals expose workers to significant biological, chemical, physical, and psychosocial hazards, resulting in high injury and illness rate compared to other industries. Comprehensive safety programs are crucial to protect healthcare workers and enable quality patient care. Priority should be given to eliminate or replacing risks per the hazard control hierarchy. Where it is not possible, robust engineering control, administrative processes, personal protective equipment, and other safeguards must be implemented. Key areas for improvement include better ventilation, sanitation, chemical substitution, mechanical aids, anti-slip floor, adequate staffing and rest period, continuous evaluation of hazard and control measure using method like HIRAC is critical. Strong management commitment and worker participation is vital to nurture a safety culture aimed at zero harm, consistent with the health sector therapeutic role. This assessment helps in anticipating future dangers that may result in accident and permanent injury to personnel, as well as damage to machinery and equipment, and the entire loss of all productivity in the hospital workplace must be avoided. The basic suggestion for effectively protecting healthcare personnel from occupational risks are to undertake regular risk assessment and apply sustainable control techniques specific to the healthcare context. To lessen the dangers in the hospital environment, training and frequent enforcement should be required.